I need to share with you an anecdote of a conversation I had with Dr. Steven Sinatra, our mutual friend, who has to be probably the brightest cardiologist that I've ever met.
Oh, for sure, Lyle.
And I was asking him, we were talking about sudden cardiac arrest, which is the biggest killer, single killer of people in our society. And it's something that happens and you're normally dead by the time you either hit the ground or way before you could ever get to the hospital. There are absolutely no symptoms of it at all, right?
It's a pretty frightening scenario, isn't it?
I said to him, Stephen, if I had a complete physical from you on Saturday, could I die of that on Sunday? He said, Lyle, you could walk out of my office, get down to the door, and die. And I said, well, what can I do about it? He said, I know absolutely nothing that you can do to prevent that, with the exception of the fact that I would tell you you need to be taking your omega-3s and your DHA, EFAs. I think that that is probably the strongest endorsement that you could ever have, at least if someone in our age groups, for that particular protocol.
Yes, Lyle, very definitely the omega-3s help to prevent arrhythmia and help to prevent sudden cardiac death.
Yeah.
Now, people who have cardiovascular problems really need to be under very careful medical management, and they need to take all of their medications. But in addition to the omega-3s, and taurine and alpha-lipoic acid are all very useful nutrients, and these are all compatible with the pharmaceuticals. There's no clash there whatsoever. The omega-3s also help to regulate cholesterol and triglyceride levels. So it's a win-win situation.
What you said is very important, and I would like to stress the fact that you said that really you need to understand and you need to follow through on the agreement that you have with your doctor and what they've provided for you. However, they need to know the benefits of being able to supplement as well for all of these conditions.
Well, the circulatory situation, Lyle, is a prime example of the need for total health management. The individual needs to keep up on everything that's coming out. They should feel free to take reports of studies to their doctor, ask their doctor to comment, and they should essentially take responsibility for physical exercise and mental exercise and all the other things that lead to a really good state of mind and good control over the circulatory system.
Thank you.
Very welcome.